Now that we had an overview of the protein synthesis inhibitors, let us go deep with the aminoglycosides. Aminoglycosides are natural or semi-synthetic antibiotics derived from actinomyces. They were among the first antibiotics to be introduced for routine clinical use, and several examples have been approved for use in humans. They are potent, broad-spectrum antibiotics that act through inhibition of protein synthesis, which includes streptomycin, gentamicin, neomycin, and others. Well, how does the aminoglycosides work to inhibit protein synthesis? It lies upon their mechanism of action. The aminoglycosides bind to the 30S ribosomal subunit and distort its structure prior to the ribosome formation. It interferes with the initiation of protein synthesis and allows misreading of the messenger RNA, which causes mutations or premature chain termination. Aminoglycosides are irreversible inhibitors of the 30S and less commonly the 50S bacterial ribosomal subunit, thereby serving as inhibitors of protein synthesis. Most aminoglycosides are bactericidal, which is likely related to toxic peptides synthesized by the 30S subunit after the aminoglycoside ribosome interaction. The nature of this interaction is potentially related to the electrochemical polarity of these drugs. Aminoglycosides are so polar that oral bioavailability is very poor, resulting in limited drug passage through lipid membranes in the gut, which leads to ototoxicity due to inhibition of the 12S ribosomal subunit in the mitochondria and in the endothelial and vestibular cells. It also leads to nephrotoxicity due to permeabilization of cells in the renal proximal tubular cells and neuromuscular blockade due to acetylcholine receptor antagonism. Aminoglycosides are used in the treatment of severe infections of the abdominal and urinary tract, as well as bacteremia and endocarditis. They are also used for prophylaxis, especially against endocarditis. And that ends our discussion about aminoglycosides. Thank you!